Welcome to Module 2 of our Family Guide to Understanding Dementia and Alzheimer's Disease. This module is all about recognizing the early signs of cognitive decline, a crucial step in advocating for your loved ones. In Module 2, we'll dive deep into 4 lessons: identifying common early symptoms, distinguishing normal aging from dementia, exploring risk factors and prevention strategies, and knowing when to seek professional help. Each lesson will provide practical tools, real-life examples, and actionable steps to empower you to support your loved one effectively. By the end, you'll feel confident in spotting concerning changes and taking the right steps forward. Let's begin with Lesson 1, Common Early Symptoms. In this lesson, we'll explore the early warning signs of cognitive decline, helping you identify specific behaviors that may indicate dementia or Alzheimer's disease. You'll learn how these symptoms vary across individuals, why early recognition is critical, and how to contextualize changes through real-life examples. We'll also discuss how to track these changes to prepare for discussions with healthcare providers. And our goal is to equip you with the knowledge to notice subtle shifts, but act proactively. So let's begin. The early symptoms of cognitive decline often appear gradually, making them easy to overlook at first. One of the most common signs is memory loss that disrupts daily life, such as forgetting recent conversations, events, or appointments. For example, your loved one might ask the same question multiple times in an hour, or rely heavily on notes and reminders for things they once remembered easily. Another key symptom is difficulty with familiar tasks. Think of someone who's always cooked family dinners, but now struggles to follow a simple recipe, or forgets how to use kitchen appliances. Language problems are also common, such as trouble finding the right word during a conversation, or difficulty following a discussion. Disorientation, like getting lost in a familiar neighborhood or forgetting the day of the week, is another red flag. Lastly, poor judgment, such as giving away money impulsively or neglecting personal safety, can signal cognitive issues. These symptoms may not all appear at once, but their persistence and impact on daily life are what makes them concerning. So let's reflect. Have you noticed any of these changes in your loved ones? If so, consider jotting them down to track their frequency. Beyond cognitive challenges, dementia often affects behavior and mood in noticeable ways. You might observe mood swings where your loved one becomes unusually irritable, anxious, or depressed without an obvious trigger. For instance, someone who was once calm might snap over small frustrations, like a misplaced item. Social withdrawal is another key sign. Perhaps they stop attending family gatherings, lose interest in hobbies like gardening or golf, or seem disengaged during conversations. Personality changes can also emerge, such as becoming unusually suspicious, believing others are stealing from them, or showing apathy toward things they once cared about deeply. For example, a once social grandparent might avoid friends or seem indifferent to family milestones. Apathy in particular can be subtle but significant. A lack of motivation or emotional response to activities they used to love. These changes can be distressing for families as they alter the person you know. Recognizing them early helps you differentiate between temporary mood issues like stress and potential signs of dementia. Take a moment to think. Have you seen your loved one withdraw or act out of character? These observations are critical for the next steps. Why is spotting these symptoms early so important? First, early detection can lead to timely interventions such as medications or lifestyle changes that may slow the progression of dementia. For example, some treatments for Alzheimer's work best in the early stages. Second, it gives families time to plan, whether that's arranging support services, exploring care options, or discussing legal and financial matters like power of attorney. Third, early recognition helps rule out treatable conditions that can mimic dementia, such as medication side effects, vitamin B12 deficiency, or thyroid problems. For instance, certain medications for blood pressure or depression can cause confusion that's reversible with adjustments. Early action also reduces stress for both you and your loved one, as addressing concerns promptly can prevent crises, like safety issues from forgotten medications. Finally, recognizing symptoms empowers you to advocate effectively with healthcare providers, ensuring your loved one gets the right care. To illustrate, consider a family who noticed their mother's confusion and sought help early, leading to a treatable diagnosis of vitamin deficiency rather than dementia. Early recognition is your first step in making a difference. To make this more concrete, let's look at two real-life examples. First, meet Jane, a 70-year-old retiree who's always been organized. Recently, she's forgotten multiple doctor's appointments and struggled to follow recipes she's used for decades, even burning food because she forgot the stove was on. Her family noticed she repeats questions about upcoming events, which is new for her. Second, consider Tom, a 68-year-old who loved his weekly card game with friends. Over the past 6 months, he stopped attending, citing confusion about the rules, and has become unusually irritable when asked about it. These scenarios highlight how symptoms like memory loss and withdrawal can show up in everyday life. A key question for families is, how do these changes differ from occasional forgetfulness, like misplacing keys once in a while? The answer lies in their frequency, persistence, and impact on daily functioning. Tracking these patterns, perhaps in a journal, can help you determine when to seek help. Have you seen similar changes in your loved one? If so, how often do they occur? One challenge in recognizing dementia is that symptoms vary widely from person to person. For some, memory loss is the first sign. For others, it's mood changes or disorientation. Symptoms may appear gradually, over years, or seem to emerge suddenly after a triggering event, like a hospital stay. Cultural and personal factors also play a role. Someone who's naturally stoic might downplay their struggles, while language barriers can make communication issues harder to spot. Coexisting conditions like depression or anxiety can mimic or mask dementia symptoms, complicating the picture. For example, depression can cause memory lapses, but they're often reversible with treatment. To navigate this variability, observe changes over time, say a few months, and note their impact on daily life. A family member who forgets names occasionally is likely fine, but one who consistently forgets important events may need evaluation. Tools like symptom checklists from the Alzheimer's Association can help you organize your observations. Variability underscores the importance of patience and persistence in tracking changes. To wrap up Lesson 1, early symptoms of cognitive decline include memory loss, difficulty with familiar tasks, language problems, disorientation, and mood changes. These signs vary across individuals but often disrupt daily life. Recognizing them early enables timely intervention, helps rule out treatable conditions, and supports family planning. Tracking patterns and using real-life examples can clarify when changes are concerning. By understanding variability, you're better equipped to advocate for your loved one. Next, we'll explore how these symptoms differ from normal aging. Now that we've covered the common early symptoms and how they manifest, you might be wondering how to tell if these changes are part of normal aging or something more serious. In Lesson 2, we'll compare normal aging with dementia using practical tools and examples to help you make informed observations. I'll see you in Lesson 2.